Hello and good evening, class. Today we're going to be talking about eHealth Exchange for the future. I'm your presenter, Samantha Galbraith. So let's dive into it. Today we're going to start off with talking about the definitions and what is eHealth Exchange. So I pulled a few definitions from two reputable sites, the first being healthit.gov. Health Information Exchange allows healthcare professionals and patients to appropriately access and securely share a patient's medical information electronically, as well as a mission statement for Healthcare Information and Management System Society, also known as HIMSS. It defines eHealth Exchange as a group of federal agencies and non-federal organizations that come together under a common mission and purpose to improve patient care, streamline disability benefit claims, and improve public health reporting through secure, trusted, and interoperable health information exchange. So what are the benefits? And this slide, we're going to highlight the benefits of now. So when you go into the office or, you're going to see a provider getting treatment, what does that look like? So as mentioned, the Health Information Exchange article, we hope to reduce medication and medical errors, hopefully eliminate unnecessary paperwork. We have these tools to help with clinical decision-making, and hopefully reduce duplicate testing, which overall, with all of these systems together, reduce health-related costs for the patient, making it a lot more affordable for a patient to go and see the doctor when they need to. And something I want to touch on is provider to provider. They can look at results across state lines because, as mentioned by the U.S. Department of Health and Human Services, the HIPAA privacy rule does not prohibit eHealth Exchange from going across different states. And the benefit of that is if a patient, if they're traveling or moving, we don't want to reduce or limit their access to care, especially, if they're had an accident away from home. We want information at the patient's disposal. And what are the benefits moving forward? So these are going to be like benefits for the future. And, we hope to see cross-facility utilization, whether that be transitioning care and, hoping to reduce readmission rates to the hospital, and also, care management loads. And this will overall hopefully advance financial and clinical analytics and faster feedback loop between research and actual practice, and improve overall public health reporting and monitoring. How can quality measures be reported? So as mentioned by quality improvement organizations, CMS, or the Centers of Medicare and Medicaid Services, they use electronic clinical quality measures, and these measure the overall quality of healthcare provided. So a couple ways that they do that: they have an organization, which shorthand name is a QIO. They measure they should ensure Medicare payments are made for necessary tests, and they have two different breakdowns of how they do that. They go based off beneficiary and family-centered care. So this is going to be reviewing all the beneficiary complaints and, if it was appropriate, and quality of care reviews. And if a patient wanted to appeal provider decisions to stop certain services for them, they can go and do that and review those claims. Another section of it is Quality Innovation Network. So these are more data-driven initiatives. They look at something they look at is coordinating post-care when the patient is discharged, improving overall clinical quality, and just anything more data-driven. And with these findings, CMS is required to give it to Congress and present it every fiscal year. So this is better oversight and hopefully would improve care for patients and provider experience. How does it improve healthcare equity? So something that we talked about in our readings this week was racial disparities. And racial disparities is still something that is seen in healthcare and is an ongoing issue today. People of color, especially Native Americans and Blacks, have higher feelings of medical distrust when compared to whites. This often leads to feelings of segregation and lack of visiting providers in a primary care environment. This is due in large to social economics and access to healthcare as an overarching theme. When we talk about social economics, considering things like location, status, income, everything overall plays a big part in patients not feeling comfortable to go into the hospital setting, especially, if they have an assigned provider and it doesn't feel like that provider is listening to them, or, really believing their claims. Something we also talked about in the article is African Americans are less likely to use primary care and are more likely to use emergency departments and hospital outpatient departments when compared to whites. So this also goes into the idea of distrust in healthcare. But hopefully once a patient finds a provider that they're comfortable with, they should have the right to share their health information with the professional of their choice. And hopefully, access of information shouldn't be an obstacle. It should reduce redundant testing again. So if, the patient was treated, maybe wasn't heard, at least their tests, they can get a second opinion. And overall, they should have all that information at their disposal so they can reduce healthcare costs. So that is the end of my presentation. If you have any further questions, please let me know, and I look forward to hearing from you. Thank you.